Good morning. I am Dr. Mireille Medhat Shukri, lecturer in Department of Forensic Medicine and Clinical Toxicology, Faculty of Medicine, Sohag University. It's my pleasure, dear professors and colleagues, to participate with you today in the 11th Scientific Conference of Ain Shams University. Our topic today about a case report I have observed by myself in Sohag University Hospitals, acute toxic encephalopathy due to thermal hydrogen cinamide toxicity in Sohag government. First of all, pesticides are used all over the world and are considered one of very common causes of accidental, occupational, and intentional poisoning. Hydrogen cinamide is used in developing countries like Egypt, Mexico, Chile, New Zealand as a plant growth regulator as blue liquid commercial product. This blue liquid commercial product called Dormix, and in the case we will report it, used Cormix, which is sprayed to many plants like grapes, kiwi, apples, pear, peaches, plums to stimulate uniform flowering and maturity. This is Dormix. This is the commercial product. It's commonly used in Egypt to promote grapevine budbrick, which is heavily planted along Egyptian Nile Delta. In Upper Egypt, like Sohag, not well known, and there is ignorance about this dangerous product among farmers and especially among doctors. They don't know about Dormix. This we observed it when we examined this case and followed up. Many doctors in Sohag didn't know or heard about Dormix before. Hydrogen cinamide is highly toxic and may be fatal if swallowed, inhaled, or absorbed through the skin. Toxic exposure is mostly unintentionally reported in occupational settings. Like this case, this was unintentionally and occupational setting due to using it without safety precaution. Exactly as this case, no safety precaution were used. According to Muhammad et al., 2010, Dormix toxicity cases occurred in the first 3 months of the year from early January till March, which is the period when hydrogen cinamide is used to promote grape buds in Egypt. This case occurred in the last year in January, exactly as reported that most cases occurred in the first 3 months of the year. Little is known until now about the exact mechanism of action of hydrogen cinamide. Experimental studies showed that cinamide is activated by catalase. When activated, causes catalase inhibition. This inhibition results in oxidative cell damage and uncoupling oxidative phosphorylation. Dormix also inhibits aldehyde dehydrogenase and can produce disulfiram-like syndrome. Dormix can both local and systemic effect. Local effect from contact includes severe irritation, ulceration of skin, eye, GI, respiratory tract. Systemic poisoning by hydrogen cinamide can affect liver, kidney, thyroid gland, and may cause parasympathetic overactivity. In large doses, circulatory depression and coma are possible. CNS affection have also been reported, as revealed that Dormix toxicity causes brain edema by CT brain. This work aims to present public awareness. The main work here is we want to show public awareness about the dangerous health hazard of hydrogen cinamide, commercial product Dormix or Cormix. Like this case, he used Cormix. Through presenting this case report, especially that there is no specific antidote for it until now. This case was the first one presented to Sohag University Hospital, as Dormix not well known in Upper Egypt. On 7 January 2022, a case of 22 years old male farmer presented to Sohag University Hospital with history of accidental thermal exposure to hydrogenamide, Cormex commercial product, which is a plant growth regulator. A detailed history was taken from the patient relatives, revealed that during preparation of the solution for spraying their agriculture fields, part of it spilled upon the patient's body. On admission, the patient was confused with Glasgow Coma Scale score 5/15. Vitals of the patient were pulse of 95 beats per minute, blood pressure of 150/80 mm mercury, respiratory rate of 18 per minute, and oxygen saturation 97%. The patient had spontaneous nystagmus. The pupils were constricted. Skin examination revealed multiple vesicles and erythema, first and second degree burns all over limbs, back, and abdomen with contact dermatitis. The percent of burn about 35%. This figure 1 shown rupture vesicle, another rupture, large rupture vesicle, this in his both lower limbs. The back of the patient, large radical vesicle and erythema around it showed first and second degree burn. Full laboratory investigation will be performed for the patient, such as ABG, liver enzymes, electrolyte, CBC, renal function. All investigations were normal except ABG showed metabolic acidosis and slight increase in liver enzymes. Serum pseudocholesterol was measured and showed normal level. In addition, radiological evaluation was done also in the form of MRI. Brain showed multiple widespread cortical and white matter, abnormal signal intensity lesions scattered upon both cerebral and cerebellar hemisphere, bilateral lentiform nuclei and vermis. This picture was suggestive for acute toxic encephalopathy. Abdominal ultrasound was normal, chest X-ray was normal. Management of the patient was in intensive care unit for 3 weeks approximately in the form of supportive therapy include analgesia, morphia for pain, antiemetic and proton pump inhibitors, antibiotics, local and systemic steroids for pain. The patient was treated with sodium bicarbonate for metabolic acidosis, parenteral N-acetylcysteine, rotacysteine for liver support. After admission for 3 weeks in the patient recovered with slight memory and neural response disturbance to be followed with neurological consultant doctor. Conclusion. According to this case report in the current study, this report suggests that acute accidental exposure to Dormix or Cormex, either dermally in the workplace or accidental ingestion in those who have this dangerous product in their home, present a great threat to human life with many toxic effects like disturbed conscious level, permanent central nervous system affection that are reversible like this case, multiple vesicles in the skin, severe respiratory and gastrointestinal affection. There is a need to prevent this human disaster to repeat in Sohag Governorate. There is ignorance among farmers about how hydrogenamide is so dangerous and the proper precautions they need when using it. Recommendations: education training program and awareness creation on harmful effect of Dormix, especially among farmers. Proper precautions they need to do when they use it. Adequate information about full personal protective equipment should be given to farmers. Also, doctors need to know about the dangerous and supportive treatment should given to this patient, as there is ignorance also about doctors in Sohag Governorate about how dangerous Dormix is. Thank you. It was my pleasure to be with you today, and see you soon. Goodbye.